HealthWorks, we know that mental health struggles and suicide risk grew during the isolation of the pandemic. So what can we do going forward? I got important information from a leading suicide expert who works in the Macomb Intermediate School District and on the Governor's Suicide Prevention Task Force. Nancy Buell.
Can you describe to us the impact pandemic had on the risk of suicide and mental health challenges?
I can say that mental health issues or challenges have started to increase in our youth prior to the pandemic. And after the pandemic, I think what has happened, and evidence is showing up that it exacerbated the problem that we were seeing already emerging. So depression and anxiety, for the most part, were on the rise, specifically anxiety, on the rise pre-pandemic. And then when the shutdowns and the stay safe orders came in and kids had to leave their environments that they were used to being able to be in and connect with and socialize in as well as learn, then that just increased their sense of loneliness, isolation, burden, just pressed on their coping strategies a little bit too much, I think.
There is now CDC data that points to a substantial increase in emergency department visits because of suicide attempts among adolescents during 2020. But Nancy points to an unexpected stat: fewer deaths.
Because of that shutdown, I believe that kids were able to be seen by their parents more. You know, the families were together. So there were positives and negatives in the shutdowns for sure.
As we sit here and look at what we can do better now going forward in 2022, whether kids are at home learning virtually or going to school, what can we as families, as neighbors, as communities do differently?
Reaching out, making sure that we're available to our youth, making sure that we're trying to open up those lines of communication, give them a voice, let them know that it's okay. Listen for stories. A lot of times adults, families, parents, educators, they want to have the answers when youth have stressors or problems in their life. If we can just listen to them and help them know that they have the solutions and they have the answers within themselves. And then if they need a little help with that, then ask them, do you want some help trying to solve that problem or pressure that you have? And listen to them, let them tell their story, validate it, normalize it, and help them engage in healthy coping.
We always want to give out the Suicide Lifeline. It's a good resource. It's 1-800-273-TALK. And on Saturday, Kevin's Song, a suicide awareness organization, and Detroit Public Television are offering a free live digital event, Surviving Suicide, Erasing the Stigma. So we'll put a link to that free event on fox2detroit.com. That's HealthWorks. I'm Dina Centofanti.